Caroline Crain. Maybe it's just Crain.
Good morning, Chairman Rose, Commissioners, and their good. My name is Caroline Crain, and I'm a medical student from Houston. I also served as the Public Health Fellow at Texas Jail Project at the Schweitzer Fellowship and at the UT Health School of Public Health in Houston. I'd like to sincerely thank Dr. Porsa for his recommendation of me for the vacant community member seat on the Administrative Rules Committee. I'm deeply grateful and excited at the prospect to continue to serve Texans and work towards a more just and humane system. I'd like to use my 3 minutes today to touch on issues which I hope to address further within the committee and alongside the Jail Commissioner. In October, I had the opportunity to spend a month-long clinical rotation at the Dunn Psychiatric Center in Houston, working alongside a forensic psychiatrist to care for patients on a competency restoration unit. Today, I'd like to highlight 2 major takeaways that I believe warrant immediate attention. First, I'd like to address the inappropriate funneling of individuals with intellectual or developmental disabilities into our competency restoration system. In my experience, anywhere from 25 to 50% of our competency restoration unit was diagnosed with or suspected to have some form of permanent intellectual impairment. And I found it confusing why these individuals were undergoing restoration in the first place when they likely had no inherent capacity to achieve competence. These patients were often the most challenging, as they were unlikely to restore, but restoration continued to be attempted per the court for over a year, and their eventual discharge to an appropriate facility was extremely challenging, given many of them continue to carry pending charges. Second, I'd like to address the treatment of psychosis in jails. Psychosis is thought to be caused by an imbalance of certain chemicals in the brain, and these chemicals, when present for long enough and in high enough quantities, are capable of rewiring the brain in a way that's long-lasting and even sometimes irreversible. When someone who experiences psychosis is treated quickly with appropriate medications, outcomes are generally good. However, when psychosis is not identified or treated promptly, an individual's brain is essentially poisoned by this chemical excess, rewiring neurons in a way that makes it difficult or even impossible to restore. This brings me to my second point. While I understand that the Jail Commission has limited ability to regulate the practice of medicine in jails, I strongly recommend attention be paid to the concern of medication petitions on patients experiencing psychosis in jails. When patients refuse appropriate medications, they languish in jail for upwards of a year waiting for a restoration bed, the whole time becoming more and more treatment resistant. Prompt intervention while they wait for restoration is key. While many jails do successfully file medication petitions, many do not, and I understand that to likely be a combination of a lack of knowledge as well as a lack of specific mental health courts in some counties. Regardless, failure to promptly treat patients in jail significantly prolongs their hospitalization for restoration and increases the odds that they will be found unlikely to restore when they might have been restorable given prompt treatment of the psychotic episode that brought them to jail in the first place. Thank you all for your time today, and I'm excited to collaborate more going forward to care for this uniquely marginalized population.